Hi, my name's Alex Newt and I'm the admissions tutor here at Cardiff University for the Mental Health Nursing programme. Thank you so much for joining me today. We've got about 20 minutes to cover quite a lot of ground really about the profession that I'm very proud to be a member of, and also the programme we run here at Cardiff University, which will prepare you to join that profession as well. So why is it important to think about mental health nursing? Well, I think we've all seen over the last 10 to 15 years an increasing importance paid to the impact of mental health problems on our society, our families, and on ourselves as well at times. You may have seen this 1 in 4 figure before for people who at some point in their life will experience a mental health problem. This seems pretty consistent across the world, really, and Wales, if it is different in any way, we could suggest that it might even be closer to 1 in 3 adults will seek treatment for at some point a mental health problem. So that's a large number of people, both locally and globally, who need support with their mental health at some point in their lives. We can see that this number of 1 in 8 children and young people having mental health problems as well has grown over the last 10 to 15 years. And while there's an awful lot of speculation as to why that may be, the truth of the matter is that there is a large constituency of people there who require support at this early stage in their life. Mental health nurses will be there for that as well. Let's not forget that depression is at the moment the leading reason for people to visit their GPs and to spend time off work as well. So quite regardless of the lost productivity to the UK and globally, again, of those missing hours of people because they're experiencing low mood, the impact on the individual is something that we just can't ignore. And mental health nurses work all the way from primary care through to some quite specialist services helping to support people when they have issues with their mood. Let's not forget as well that mental health nurses work with older people with things like Alzheimer's disorder or frontal lobe dementias or other kinds of progressive degenerative disorders, and that with our ever aging population, that this particular group of people are going to be a concern for our profession for quite some time into the future. So how does our programme here work? We've kept to the NMC guidelines suggesting that a 50-50 split between theory and practice is ideal. We feel it's very important to make sure that our students, through things like our lectures, tutorials and workshops, gain the theory they need to underpin proficient best practice in mental health care. You will spend some time in simulation, but rather than rebalance that 50-50, what we want our simulations to do is to help you contextualize a specific set of complex clinical interventions and skills so that when you do go out onto your placements, that you will feel confident in the way that you approach our service users and that you approach care. While you're on those placements, you'll be supported by experienced colleagues from nursing and from other members of the multidisciplinary team as well. And you'll get the opportunity to study in a wide range of clinical contexts. And I'll talk more about our clinical placements as we go along. Here's how the 3 years are structured. You can see here that you'll be spending time in theory and practice across the 3 years of the programme. There are mental health modules amongst each of the 3 years as well. And you can see here, I'm sure, as well in year 3, that our mental health nursing content becomes even more emphasised as you approach registration. But just to be reassured that the shared modules that you'll have each year actually provide really good opportunities to learn alongside our adult and children's nursing colleagues, because there are many aspects of nursing which are core and fundamental to all fields of nursing. Nursing is our core profession and care is our business. So the things that you learn in common in those shared modules will give you every bit as much preparation for your role as a mental health nurse as the field-specific modules themselves. And as you can see at the bottom there are a range of different assessments that you'll have across each year of the programme. Those things may be assignments, they could be numeracy testing or exams or presentation assessments as well. So lots of different and innovative ways that we're looking to make sure that you can be confident in your skills and your knowledge by the time you get to the end of the programme. One of the other features that we have at Cardiff University is a module that focuses on global health concerns. And as part of that, there is an opportunity, should you wish to pursue it, of spending some time studying in other clinical contexts in other countries. We have placed students in many different areas. I've had, for instance, personal students who have studied in African countries and have learnt about how mental health care is seen in very different ways, and also about how different cultures impact on our experience, both of mental health and also of interventions as well. I had another student who I used to work with who spent time in a high secure environment in New York and came back with some fantastic ideas and insights into how that particular different service worked with people with offending behaviours as well as mental health problems. Cardiff University is very keen to make sure that we support students who want to go abroad. So, for instance, there are grants and bursaries available for students who want to undertake those practice placements overseas. If you are interested in doing that, then our advice is always to listen very carefully to the lectures and sessions you'll get early in the programme, talking to you about the process of organising those placements and applying for those bursaries as well. This really is something which has been a transformative experience for students who've undertaken it. And I think this thing about valuing the NHS even more when you come back is an important point to make here as well. So really something to consider as a unique opportunity that we offer here at Cardiff University. So what do mental health nurses actually do? Well, I think when I first applied to become a mental health nurse, my friends thought that I'd probably be spending all of my time wrestling with disturbed and aggressive patients involved in some kind of restriction or restraint on their liberties, because that's what mental health services were like, aren't they? I didn't think that when I applied for the programme, and I think I would have been pretty reluctant to do so had I believed that was true. Luckily, it was me that was right and not them. I think we do have to accept that sometimes when people are vulnerable because of a mental health problem or are lacking insights into the kinds of services that are being provided to keep them safe, that they can become very anxious, and at times that can result in their behaviour becoming very challenging, and that's really a challenge in terms of their ability to control their behaviours and their emotions. And at that time they need an awful lot of support. And actually, working in mental health services, the fact that nurses are prepared for and trained to meet those kinds of challenges can make those services safer than some other areas of healthcare as well. And here at Cardiff, you'll start that journey of learning about things like de-escalation skills, recognition of warning signs, breakaway techniques should they be needed, so that when you go out into practice, you can feel safe whilst you're working on those wards, surrounded by a team of nurses and other professionals who are skilled in managing challenging situations. I think my mum convinced herself that I'd be spending my time doing lovely activities like basket weaving or community activities, partly because she didn't want to think about those Mexican wrestlers there whilst I was a student nurse. But actually, she wasn't that far from the truth either. One of the great things about mental health nursing amongst all of the professions involved in this care is that we get to spend time with people. And that's actually a really important indicator for recovery, particularly in inpatient settings. Having time to be able to listen to people and to consider our therapeutic relationship is very important to our service users. So we're really privileged in that way to work with people in social and recreational as well as clinical ways. That said, I'm guessing that for an awful lot of service users, what they see from a mental health nurse is someone who is barring their exit from a ward, for instance. And actually the metaphor of the door does stand up, I think, because there are times when we need to protect people because they are vulnerable. And that's what that locked door means to me, really, is that while you are here with us, we are keeping you safe. And actually, My job as a mental health nurse is to think about how to open that door for you and to encourage you to walk through it safely and in a way which allows you to be supported, that hopefully you never end up being required to be behind that door again. I think an awful lot of the image that mental health nursing has in the UK and beyond might come down to this person, Nurse Ratched, who you can see in the next picture, of what society thinks that I do. Nurse Ratched from One Flew Over the Cuckoo's Nest represents a very, very old-fashioned, paternalistic approach to mental health care, which emphasises regimented and very, very controlled experiences of professional care, including lots of medication and restriction. And that type of care, that model of care, is something that mental health nursing left behind a long time ago. We're a very progressive profession that really puts the person at the centre of our concern. And that, I think, is what makes mental health nurses believe that what they can do is walk on water, which is what that image originally meant when I introduced it to my open day presentations. But actually, over the last couple of years, the more I've given this presentation, the more it's occurred to me that what's important are some of the aspects actually that the dog represents, in that we do seek to be a faithful companion on someone's own journey from mental disorder to recovery, and that we keep them safe. We're someone that will listen to them, and we will someone who will give them what our core conditions call unconditional positive regard in the way that we work with them. So actually that metaphor of the journey and the companion is a very strong one for me in mental health nursing. Which brings us to what mental health nurses actually do. Now, yes, we are the coolest field of nursing, that goes without saying, but also the reason that Marlon Brando and his film The Wild One is represented in this particular slide is because in that film he's asked a question, and the question is, what exactly is it that you're rebelling against? And his response is, what have you got? And that represents a very, very key facet of mental health nursing for me, which is our flexibility. That when people come to us, or when people need our help and our support, that we can really treat each person as they come along as an individual and think, what is it that we can do to help you today? And if we don't have the skills and knowledge to provide that right now, we will go away and find out how we can do that, whether that will be individual psychosocial interventions, learning about how to facilitate group working, or even in some cases as nurses, making a strong case to set up a new service and to manage and run that service to meet people's needs. So flexibility and creativity are really key attributes for mental health nurses. So how does our program help you to do that? Well, we want you to become this progressive, fit for practice nurse at the point of registration, so that when you qualify, you will feel as ready as you possibly can be to take up that person-centered approach to professional registered practice. So these are the foundations of our course, really. We will help you to get that greater understanding of what collaborative care actually means for us in mental health. And to do that, we need to start from a place of value and clinical reasoning. So these are our twin kinds of pillars that we build our knowledge upon: our values and our critical appreciation of theory and how it applies to practice. In South Wales at the moment, there's been an awful lot of development of mental health services. So some images here, for instance, of new older people services and working age adult services at Landock Hospital just outside Cardiff, where they have everything from working with people with forensic history in low secure services or addiction services. There's a crisis resolution ward there as well. But there's also national services like the Welsh Neuropsychiatry Service based in this hospital. And we're very lucky to have that access to the largest healthcare provider in Wales and one of the largest in the UK. And that range of generic and specialist, regional and national services that these areas represent. We work across South East Wales. So Ysbyty Ystrad Fawr, for instance, in Caerphilly has an inpatient unit and community services based there. We'll go as far west as Bridgend for Caswell Clinic, which is a medium secure unit. There's also a child and adolescent mental health services inpatient unit in Bridgend that students are placed at. And our placements will go as far as Abergavenny in the north of Gwent as well, where there are a range of low and medium secure services, very similar to the ones that you'll find just outside Pontypridd at Heatherwood Court, which is that last image there, which is an independent provider that we work with. What we want our students to do is get a breadth of experience of different kinds of mental health care right across South East Wales. So the majority of our placements are in that Cardiff, Newport metropolitan area. We have a fantastic team of lecturers here for you at Cardiff University with a wide range of experiences. So for instance, we have Norman Young, who is a consultant nurse in serious mental health for Cardiff and Vale, who spends time with us and has a real interest in teaching about issues to do with pharmacology, for instance. And Professor Ben Hannigan, who has an international reputation for his work in collaborative care planning and engagement with service users. But real expertise in every field of mental health nursing. Dean Whitebrow, for instance, has just achieved his doctorate looking at trauma-focused care. He's a former naval officer with an interest in PTSD. Mandy King is a former RCN Older Persons Nurse of the Year. We also have many members of our team who still work in practice. Gerwyn Jones and Paul Bickerstaff spend a day each a week in practice looking at issues to do with psychosocial interventions and working with older adults in the cases of those two particular lecturers. Anne-Marie Bollen has spent time working with students, service users and other lecturers to take her interest in storytelling in mental health to various conferences as well around the UK. And Nick Weaver is our newest member of staff, who's also a Doctor of Nursing, and he joins us just in the last few months, really. So we're all looking forward to working with Nick on our programme. Okay. So here are some foundational principles for person-centred mental health care, which are baked into our mental health measure. If you study nursing in Wales, you will find that the mental health measure, which came into force in 2010, is instrumental in how we learn about ourselves as professionals. And this really does begin again with our programme, because we have a legal responsibility in Wales to work in a way which is empowering, is committed to progress and holistic, that our programme really does take these values and run with them. Let's move on, shall we, and think about application. The deadline for entry now and for UCAS applications that begin in September will be in January 2021. So there might be some reason here to save some dates for interviews. The majority of our interviews take place in that first week of February there. But for early applications, or if you're interested in joining the March 21 cohort or the Spring 21 cohort, we will be interviewing as well between the 7th and 9th in December. That date is yet to be fixed, but still certainly worth putting into your diary if you are going to look to apply for the programme. Here are our entry requirements. You can find greater detail on all of these on our website or in our prospectus. But essentially what we're looking for are these 5 GCSEs and the equivalents of 3 Bs at A level. Listen, if you don't get the kinds of early ideas of your grades which thinks that you're going to meet these standards, don't be put off applying. If I get an application from somebody who looks like they're going to be a significant contributor to our programme, who I think is probably really suited to being a mental health nurse, then we can have some flexibility in these grades. So please do apply, even if you're not sure that you're going to achieve those kinds of standards. Don't be put off. You'll also have to go through a DBS check when you join the programme. Even if you've had one recently, you'll have to have another one. And there will be an occupational health questionnaire, because the NMC tell us that nurses must be of good health and character to join the register. So just have some expectations of things like a vaccination schedule that you'll need to take part in. Here are some ideas about the sorts of things that you can put into your personal statements. You might want to pause here and think, right, how can I make sure that I cover these kinds of issues when I make my application to Cardiff University? How can I make sure that I prepare myself for my interview when I look at these sorts of characteristics of mental health nurses? Another really good starting point might be to go and look at the NMC code. The Nursing and Midwifery Council are our professional regulator. They set our standards for practice. So go and have a look at those 25 standards and think about how you can demonstrate that good health and character in your personal statement and in your interview. These are the things that we'll be looking for, really. Your motivation to join us as a profession, the kinds of transferable skills and attributes that you can bring to the programme, and your insights into what mental health nursing might be. So some really key areas to look at in terms of preparing for your interview. So again, it might be worth pausing and making a careful note of those. Okay, ultimately what we're hoping is that you will join us and that you will become a Cardiff University mental health nurse who is caring, professional and thoughtful, but is critical in their approach to practice and to knowledge, and is informed by research and theory in what they do. That has a focus on not just skills and values, but the positive therapeutic relationship that I mentioned earlier on, that emphasises working collaboratively within multidisciplinary teams. This is our vision for what our nurses will look like, and we're hoping that you will share that vision with us when you come and study in Cardiff. For those of you who are very keen, here's some ideas about some background nursing that you might want to go and have a look at, such as this book by Norman and Ryrie that some of the members of the lecturing team have contributed to the latest edition of. The book in the middle here about therapeutic skills was edited by 2 team members and features an awful lot of our lecturers who contributed chapters to that as well. And don't forget that Cardiff University Mental Health Nursing has its own Twitter account that you can also join and keep abreast of our developments, as well as all of the other news in mental health care. So listen, thank you so much for your time. I hope that that's been useful for you. If you have any further questions, you can address them to our admissions department, but we hope to see you soon. Take care now.